Hello, my name is Grace Carroll and I'm a member of the team here in McMahon Goldrick Solicitors. We're a firm that specialises in birth injury litigation, and in this video I'm going to discuss a birth injury called Periventricular Leukomalacia, or PVL for short. So what is PVL? In short, it's a softening of the white matter area of the brain. It occurs in babies usually during the time of pregnancy. In particular, it's a softening of the periventricular white matter area of the brain. This area of the brain transmits nerve impulses that control motor function. With PVL, cells in this area decay and die, leaving empty voids or holes. These holes are then filled up with fluid, which results in the condition known as PVL. The damage caused by PVL affects motor movements and usually causes a tightness or spasticity in the muscles. Infants with PVL have an increased risk for cerebral palsy, which is a condition which causes problems with muscle control. They are also at risk for developmental and cognitive issues. So what are the symptoms of PVL? It can be difficult to detect in newborns, and in some cases there are no immediate symptoms, and the injury may not become apparent until the infant is a couple of months old. The symptoms are unique to each individual child, however, some of them include issues with motor movement, poor coordination, vision and eye movement problems, developmental delay that becomes increasingly apparent over time, intellectual impairment, hearing impairment, in some cases epilepsy, and sometimes spastic diplegia, which is a form of cerebral palsy that causes tight, contracted muscles, usually in the legs. And then in the most severe cases, spastic quadriplegia, which is a form of cerebral palsy that causes tight, contracted muscles in all four limbs. How is PVL diagnosed? A PVL injury is diagnosed with the use of radiographic imaging, including the use of cranial ultrasound and CT or MRI scan. It can be difficult to see the changes caused by a PVL injury to the brain when the infant is very young. Infants with known risk factors for PVL may receive an MRI early on. However, the changes may not become apparent on the imaging until the child reaches the age of 2 years, and that's when the full brain myelination process is complete. How is PVL treated? Infants who are diagnosed with PVL or who are at risk for PVL require special care upon discharge from hospital. As discussed, the imaging may not reveal or detect a PVL injury early on, so regular developmental assessments should be performed if PVL is suspected. Unfortunately, there is no medical treatment to cure a PVL injury. The damaged area of the brain will not regenerate. However, there is a wide range of rehabilitative therapies that can help manage the condition and also limit its long-term effects and symptoms. These therapies can include physiotherapy, occupational therapy, speech and language therapy, massage therapy, behavioural therapy, play therapy, orthotic input, and specialist educational input. PVL is not a progressive condition, so the injury does not gradually worsen over time, i.e. the damage to the white matter does not continue to expand after birth. Although it isn't a progressive condition, the physical symptoms usually become more apparent as the child develops. Ongoing and continuous rehabilitative input will certainly help to limit the long-term effects of the injury. So what causes PVL? The exact cause is unknown, however, it is reported that a decreased flow of oxygenated blood or cell damage to the periventricular tissue is the primary cause of PVL. The periventricular white matter is an area of the brain that is particularly prone to injury, especially in a fetus between 22 and 23 weeks gestation. At this stage, the baby's brain is especially vulnerable to the effects of hypoxia, blood flow issues, and inflammation. These things affect the cell line, which is largely populated in this white matter area of the brain, and this can cause PVL. Infections of the fetal membranes and other maternal infections are a common source of interruption to the blood supply and oxygen flow. The fetal membranes are affected by the release of toxins which travel through the amniotic fluid to selectively injure areas of the developing brain. These toxins can also cause a premature rupture of the membranes and premature birth. Bleeding inside the brain, or intrapartum hemorrhage, can also cause an interruption to the blood supply to this part of the brain. There are some risk factors for the development of a PVL injury, and these include an infant who is born premature before 32 weeks and who has been mechanically ventilated, a maternal infection around the time of delivery, an infection of the amniotic fluid, an untreated maternal UTI, placental blood vessel conditions, a twin pregnancy, vaginal bleeding during pregnancy, an intraventricular hemorrhage, which is bleeding inside the brain, an inflammation of the umbilical cord and the connective tissue, sepsis, and maternal cocaine use. How is PVL prevented? The following actions can help prevent the development of PVL: reducing the risk of prematurity, preventing a lack of oxygen or lack of blood flow to the baby's brain, reducing blood pressure swings and hypotension, and reducing the risk of maternal intrauterine. Can PVL be caused by medical negligence? In some cases, a PVL injury may have been caused as a result of medical negligence. It must be proved that there was a breach of the duty of care owed by the medical practitioner and that this breach caused the PVL injury. If you suspect that your child's PVL injury could have been prevented, then it is advisable to contact a solicitor to get further advice. We at McMahon Goldrick Solicitors specialise in acting on behalf of children who have sustained birth injuries arising as a result of medical negligence. We are the only firm in Ireland to exclusively specialise in looking after clients who have sustained life-changing birth, brain and spinal injuries. Due to the small and specialist nature of our firm, we have the ability to spend the necessary time to do a thorough examination of the medical records. We also continuously educate ourselves on the new and emerging recommended best obstetric and neonatal care practices. If you would like any further information on PVL, or if you have an inquiry in relation to a possible birth injury matter, please feel free to contact us anytime. Thank you for watching.